Now, this morning we heard from New Jersey Governor Phil Murphy. During an interview this morning, he said he expects lockdown rules for New Jersey to be in place until June at the earliest. We are joined now by New Jersey's Health Commissioner, Judith Persichilli. Good to see you here, Judith. Thanks so much for making time for us. I guess the first question is, what's the state of things right now in New Jersey? Do you believe that you've hit a peak, and are you seeing evidence that the curve is flattening in your state?
Thanks so much for having me on this morning. Well, let me just level set where we are. As we sit here today, we have a total of 68,824 positive cases in the state, and we've experienced, unfortunately, 2,805 deaths. We had our first positive case on March 4th. So 6 weeks later, you can see the trajectory of COVID-19 in our state. Right now, 8,270 individuals in our hospitals are either COVID-19 positive or are persons under investigation. And of them, almost 2,000, 1,980 are in critical care beds. We have about 18,000 licensed beds in the state and 2,000 licensed critical care beds. And in preparation for what we anticipate is the surge that we believe we're experiencing in North Jersey right now, we actually increased our critical care capacity by 100% from 2,000 to 4,000 beds. And we've increased our bed spaces. And what I mean by that is we've not only increased every available space within the hospital that can safely house a patient, but we also put up 3 field hospitals and 3 hospitals that have closed within the last 5 years. We've opened them up. So we've increased our capacity significantly to be able to handle the surge, which is predicted by we look at 3 different models, by the several different models, to be occurring right now in the north and extending through the second week in May. So things are pretty busy. I believe all of the patients are getting the care that they require. We have a pretty significant check on ventilator inventory. If the worst case occurs, and those statistics, by the way, change every day depending on the inputs, but if the worst case occurs, we might see upwards to 3,800 to 4,000 critical care patients requiring ventilators. At that point, we will be using alternatives to the traditional ventilators, meaning anesthesia machines and BiPAP machines. We expect the total cases at worst case to go as high as about 16,000. And that's good news from a couple of days ago where we felt the models were predicting 39,000, which would have put such a strain on our healthcare system. We still believe we would have the bed spaces to take care of patients, but the standard of care would really be in crisis mode.
That's definitely good news to hear. And I know we've heard Governor Murphy talk about that, Judy. This is Anjalee here. So I'm curious, we know that one of the issues has been information, and looking at public health officials like yourself. You've enjoyed a pretty prominent role in the state's response, but that hasn't necessarily been true elsewhere in other states. So what are your thoughts on whether or not we're getting the right information, in a national scope, and whether or not we have enough information from public health officials about reopening and about how to proceed from here?
Well, let's talk about reopening. You know that our governor, along with the governors, I think, of 5 states now, will be planning the reopening together. And that's a good thing because we are so close to Pennsylvania, Delaware, and New York. And then, we have a lot in common with Connecticut and Massachusetts. And the reopening is a process, and it needs to be thoughtfully accomplished. It needs to be well thought out, and I know that we will have a public health official, someone with great experience in public health, and an economist, and someone with a larger worldview than just New Jersey, as our representatives along with our chief of staff. And I have to say my role in all of this really follows the directive of our governor. He is very aware that this is a public health emergency. On February 3rd, he declared it a public health emergency, one of the first time that's ever been declared in our state. And he relies pretty significantly on what is going on in our hospitals, the predictive modeling, what we need for supplies. He knows exactly to, number one, how many ventilators we have. He just is very aware that this is a public health emergency, and the public health experts in the state our state epidemiologists are the ones that are running forward in helping us respond.
We'd love to get, well, just before we go to break, what testing looks like in the state right now. We spoke to the CEO of a company called Vault, which has a saliva test that you can do at home. We understand that's being administered in Middlesex. Where does testing stand right now in the state of New Jersey?
Currently we're testing symptomatic people only, and we've performed over 128,000 tests. We're getting a positivity rate of 44.8%. We are also in discussions with Rutgers University, who have just been approved by the FDA for saliva tests, and about how that plays into the reopening of the state, how much testing we have to do, and then how much contact tracing, so that when we do reopen, we have a pretty good handle on the extent of the disease in the state and how we can prevent further spread while we selectively and carefully open up the state, and at the same time prepare for any increases in the disease that may come in the fall or in the winter.
New Jersey's Health Commissioner Judith Persichilli, thank you so much for giving us a picture of what's happening in your state, and best of luck to you and your team.
Thank you so much.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.